Hello and welcome to the Headache Doctor podcast. Where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we're going to talk about the jaw, why your jaw would hurt, and why a dental appliance may not be the best avenue for you. You see, on this podcast and at Novera Headache Center, we want to solve the underlying problem. So we're always asking the question why. And that question why gets us to the thing that is actually needing to change in order for your issue to be resolved long term. Now, when it comes to the jaw, we want to ask the same question. A lot of our patients at Novera find that they do have jaw issues that are associated with their headaches or migraines. And so this felt like an important topic to bring up again. Now, if you are new to the podcast and you're like, man, there's like 250 of these, I don't know where to start, use it like a library, find topics that seem pertinent to you, or just start with this one and then stay tuned for next week's and the week after that. And then as we go, we'll be building a case and your understanding of headaches or migraines. If this is your first time listening, I'm so glad you're here. I'm your host, Dr. Taves. I'm the founder, owner, and one of the headache specialists here at Novera Headache Center. We have offices in Parker and Colorado Springs, and we see people from all over the world, all over the country. So if you're like, man, I don't know if I could get there, have a virtual consult with us, and we will figure out how to help you. So let's talk about the jaw. When it comes to the jaw, we need to understand what exactly is the current approach to resolving the problem and the current way of thinking when it comes to dealing with someone that has jaw pain, popping, clicking, maybe they clench or grind their teeth at night, and what's the current route that you've probably already been down. So we're going to define that, and then we're going to talk about the two main reasons or the main culprits why someone would have jaw issues, and then what to do once we understand the underlying problems and how to actually treat it so that the jaw doesn't continue down this road of constant pain, popping, clicking, or you feeling like a night guard's the only option. Okay, so when you go to the dentist, generally the dentist is the one that's going to find this problem of clenching, grinding. And I do find that it usually is patient-led. So the patient will say, hey, I've been dealing with jaw pain. Maybe I clench or grind my teeth at night, and I would like to, know how to treat it. Now, if I had to guess, maybe a 50-50%. So maybe not most of the time that's the case. And then the other half of the time, the dentist is evaluating for that, maybe seeing changes in the teeth and then providing some sort of appliance or a splint. Now, when it comes to our healthcare system and specifically for the jaw, the dental world is basically the only provider that's going to catch these things currently. There may be some physical therapists that, if they're evaluating the neck, they'll look at the jaw as well. There may be primary care docs that, if you say, hey, you've got pain, popping, clicking in your jaw, will maybe refer you to a dentist or a pain management doc or something like that. But by and large, this scenario is taking place in the dental chair as they are working on you. Maybe it's prevented you from getting dental care, like you can't open your mouth as wide as you want to, or you're trying to chew or break down foods, and the chewier the food is, the longer you have to chew, you get fatigued or you have pain associated with it. And then oftentimes people will have headaches in the morning and they'll associate it with their jaw pain or clenching, grinding that happened at night. Now, it's very common for people with headaches and migraines to have jaw issues as well. It's oftentimes not the dominant presentation, meaning they're not coming to us with jaw pain and then headaches are secondary. Usually the headaches are primary and the jaw symptoms are there, but they're not necessarily the most debilitating symptoms. That's not always true. Sometimes we have patients that do have very debilitating jaw symptoms, jaw pain, but then they also have a headache. But by and large, these two things go together. We rarely find one without the other. Now, if you just have jaw symptoms, if you just have a headache, the chances that your jaw is impacted when you have a headache from this neck problem is high. And so we're going to talk about that. And then if you have jaw pain and you're wondering, okay, how would my neck be related? The chances of your neck being related when you have jaw issues is also very high, okay? So the traditional method of treatment is, one, to say, oh, you're so stressed, you need to relax more. And this is, there may be some truth to that, but we also are not choosing stress. Like, I've never met someone who chooses stress. So I find the you need to be less stressed to be a difficult thing for people to grasp onto, because generally we are finding ways to be less stressed naturally. That is a natural part of how people live their lives, is we don't move towards stress, we move away from it. Now, there may be scenarios where someone is feeling a level of stress or anxiety that, it's sort of medically prescribed to remove yourself from a situation, but that's not generally what we're talking about here in a conversation about jaw pain. It's more so like, oh, you carry a lot of stress, you should try to relax more. Like, it's just not, it's not a tangible thing. Like, people don't go home and be like, oh, like, I just need to be less stressed. Like, that makes perfect sense, and now I'm going to like do that, and then the problem's solved. I haven't really found that in my clinical practice, and I don't think that's necessarily what's happening either. I don't think people are just carrying stress and then happen to have substantial jaw tension. Although emotional stress does manifest itself physically, and it does connect to the tension, I don't think that's what's driving this scenario in most cases, okay? Now, if there is a scenario where stress is driving it, it's going to be the exception, not the rule. And so let's back up and assume that stress is not the actual cause of your jaw tension, even though you have probably been told, oh, it's stress, okay? And then you were probably provided with a night guard. Now, a night guard is not a bad thing. So I'm not anti-night guard, but it is a crutch in a sense, okay? So foundationally, I believe that we were not created in a sense that needs, like, our bodies don't need something in addition to, just our general health, diet, sleep, breathing oxygen, like these things that we naturally do. It's not like you were, developing and you're like, oh, like you just needed a night guard. No, we don't walk forward with that assumption. It would be like, oh, like you have a limp and so you just needed a crutch. Like you needed a crutch to move around. That's just like how you were created. That's not the assumption that we want to make. So a night guard is looked at as a crutch. Now, just as crutches are helpful when someone's limping, a night guard can be helpful when we need to reduce tension on the jaw for short periods of time, or if we are seeing wear and tear on the teeth. And typically dentists and general dentists, by and large, will look at the teeth and wear and tear on the teeth and then prescribe a night guard in order to prevent the teeth from wearing down even further. But night guards do have benefits to the jaw joints themselves and potentially reducing stress, improving the position of the bite, things like that. And so there's the general night guard, which is basically like this custom splint that I don't know why, but they're like terribly expensive. And you wear them every night, basically for the rest of your life, and they keep your teeth from actually contacting each other, and that protects your teeth from that wear and tear, the grinding down, the cracking, the fractures, whatever it is that the dentist was seeing. Now, there's other appliances that are more intended to reduce stress on the jaw itself. So these could be appliances that go like just on the front teeth or just on the back teeth. They prevent the back teeth from touching, which allows the jaw to relax in a sense, or puts the jaw joint in a better position. There's also appliances that correct the bite. And so when you bite down on the appliance, the jaw joint itself is in a better position, and that better position allows for relaxation or a lower level of tension to be built up if you are clenching or grinding. And some of these appliances work really well, and we refer patients out for some of these appliances in order to restore the bite, in order to get the jaw joint in the right position, things like that, okay? But by and large, dental appliances are a crutch in a sense, and probably prescribed by the dentist is going to be more of a teeth-focused restoration or prevention of further wear and tear, as opposed to a joint-specific corrective issue. So if you see a specialist that is trained in how to treat the jaw joint itself, then you might be receiving an appliance that's more jaw joint specific rather than teeth. But usually there's an element of both in all of them. It's just a matter of what type and what sort of focus that dentist has. And by and large, most of them are going to be more teeth focused. Okay, so let's understand the anatomy of the jaw and why that's important. So when we look at the jaw, it's one single bone, and then we have two joints on either side of that bone that connect into the skull. And now each of those joints is surrounded by several muscle groups, small muscles, big muscles, that allow the jaw to open and close. Now, by and large, most of the muscles in the jaw allow it to close. There's not too many that help it open, but closing is the important part of the jaw that allows us to chew food, what's called mastication. So we chomp down on the food, and our jaw is very, very powerful. And so we can break down lots of different types of food, and it's a wonderful thing. We can chew on chewy steak. We can bite into apples. Our teeth are shaped differently in order to allow us to break down these different types of food. Now, the jaw joint is, in a sense, floating, and because it's floating, the position of our head and gravity pulling on it is going to, over time, change the resting position of the jaw. So meaning, whether muscle tension pulls to one side or gravity is just sort of pulling to one side because our head's tilted, the jaw, because it's floating, will respond to that. So over time, you'll get this shift in the position of the jaw if our head's tipped or if we have tension pulling us to one side. And we're all very asymmetrical people, meaning we do things dominantly on one side. And so there is natural imbalances that we find, and then we see that oftentimes in the jaw itself. Okay? So one bone, two joints, and the bone itself and all the musculature is responding to what the head position is, what the neck is doing, and then also the tongue, how we swallow. There's all sorts of dynamics in there that the jaw is responding to, because it's not like the elbow joint where it just has one range of motion. The jaw can go side to side. It can open and close. You can do, circles with your jaw. You can do all these different movements because it is a very mobile joint. In order to chew, break down foods, we need to be able to put our jaw in different positions in order to break the food down. So the reason why that's important. So when we look at the underlying issues that then lead to someone clenching or grinding at night or just having jaw pain in general, I like to go back to the why. Like, why would someone be clenching or grinding at night? And I don't often love the answer of stress. Oh, they're just stressed. Because a lot of people have stress, and stress shows up in different ways. You could have jaw tension, you could have shoulder tension, you could have low back pain, you could have whatever it may be. Like, it's not the same. So why would someone have jaw tension and that manifest as stress manifest as jaw tension? And so there's got to be something behind this other than stress. And so in all of my interviews and then working with patients and then research in looking into like what actually impacts the jaw, there starts to be, we found some very clear underlying issues. One that has to do with development and also neck movement, positioning, resting posture, things like that. Okay. So first off, airway. When we think about the jaw, we can't separate the jaw from airway. All right. Now, most of the time we should be breathing through our nose. Our nose is able to warm the air. It's able to produce nitric oxide. It's very helpful for us to breathe through our nose to be in a rest and digest state. When we breathe through our mouth, we don't get those benefits, okay? So we're intended to breathe through our nose. When we breathe through our nose, we not only get those benefits, but we allow our jaw to be at rest, okay? So especially at night, when you're breathing through your mouth, an abnormal way of breathing, your jaw is open, it's likely going to fall back, your tongue might be falling back into your airway, and then you potentially are thrusting your jaw forward, okay? So then we have to continue asking why. Like, why would someone be breathing through their mouth at night? And when we look at that, oftentimes there's either a narrow airway, so a small airway. So when someone breathes through their nose, there's enough resistance. They're not able to get the air through their nose, and so they automatically default to their mouth. And so why would someone have a smaller airway? Goes back to development and potentially something like a tongue tie, or maybe the types of foods that the child was eating, the ability to chew, break down foods, solid foods at a young age is important because it does, one, force the tongue to move all around the mouth. It forces the jaw to get stronger, and it helps with the development of the upper palate. And so when it comes to whether it's swallowing or chewing solid foods at a young age, it helps develop the upper palate. And then when we look at culture, like foods have become cheaper, easier to process, more shelf-stable. That oftentimes means that we don't need to chew as much either because we're missing out on fibrous foods, the vegetables, the meats, the whole foods that we should be having in our diet are replaced by processed foods that are higher in calories and easier to break down. And so that shift has potentially led to an increase in the underdevelopment of the nasal passage and then ultimately mouth breathing. Okay. Now, when it comes to another consideration with airway is tongue ties. So oftentimes tongue ties prevent a child from latching when they're breastfeeding when they're young, and there's which can quickly lead the mom to go to formula fed kids or bottle fed kids. And so this is actually a very common thing. When you start to look for this, and even with ourselves and then our friend groups, like 2 of my kids have had to go through tongue tie procedures. And then I would say the majority of the friends that we have, when they're aware of this, they realize, oh, I need to get my kid checked. And when their kid is checked, there is something that when they release the tongue or release the upper lower lip, they're able to latch, to suck, to improve the mobility of their tongue, so their tongue can then press to the roof of their mouth, which can widen the upper palate, which helps improve the nasal passage, okay? And so all of that in development is important, and that's not the only reason why someone would have airway issues, but it is a big one that we can control, okay? And so airway being restricted, not able to breathe through your nose, leads to mouth breathing. Mouth breathing at night means that you're going to potentially have an obstructive sleep apnea where your tongue will fall back into your airway. You'll have to thrust your jaw forward, and you're just sort of repeating this in order to breathe over and over again throughout the night. And so you wake up and your jaw's kind of sore and achy and it's popping, clicking. I have a headache and I feel exhausted and all those feelings, which if you're listening to this and this is you're like, yes, that is totally me. You're understanding what I'm saying. And it probably feels like I'm speaking right to you. And we see this all the time. People wake up, they don't feel rested. They feel like, they just got hit by a truck, or they have no energy. Their mouth is dry. They know that they're breathing through their mouth at night. They don't necessarily know how to correct it. And since we're on this topic, a few simple tricks for this are to use Breathe Right strips, the nasal spray called Clear, or just like a xylitol nasal spray, get at Natural Grocers or Sprouts, maybe Whole Foods. And then you can also try mouth taping. Now, if you can breathe through your nose for 5 minutes, then there's a good chance you don't have an obstruction to the point where you can't breathe through your nose. If you can't breathe through your nose for 5 minutes, if you're trying to, your lips are sealed, and within that 5 minute time frame, you have to open your mouth because you're just not getting enough oxygen, then I wouldn't necessarily say oh, try these tricks. I mean, they may help a little bit, but ultimately you need to consult with an ENT or an airway specialist to understand why you can't breathe through your nose for that long, because it should be very comfortable breathing through your nose. And oftentimes people just have a habit of breathing through their mouth, and then they just need to work on reversing that. Okay. So airways, the first reason why someone would be clenching, grinding, that would cause these jaw issues. Okay. The second main thing that we see is neck tension, neck problems. By and large, the pattern that we're seeing is a slight head tilt, and more so to the right. When people have neck tension, their head sitting on the atlas, the first bone in their neck, the atlas will be shifted to the right, which causes the head to have a slight right side bend. Now, the reason for this is probably connected to the habits and the repeated movements and positions that we put ourselves in throughout the day. So whether it's sitting to one side, crossing our legs, and it's always the same leg, standing and shifting our weight onto one hip, or using the phone or driving our car with one hand on the steering wheel, brushing our teeth. So all these different things, we bias one side, and typically it's the same pattern, right? Like it's the same side, it's the same lean, it's the same shift. And so that shift multiplied by years leads to these asymmetries in how we, in our resting position. And so right-sided head tilt is very common, and that right-sided head tilt will pull the jaw to the right as well because gravity is just kind of pulling it in that direction and muscle tension is pulling it in that direction. And so over time, we see the stress on one of the jaw joints to be greater than the other, and both are undergoing some level of stress because of this asymmetry. So the jaw wants to be in neutral. When it's not in neutral, it has to compensate because the teeth want to contact each other appropriately. They know how they should fit together, and they are trying to do that every time you bite down. The teeth are sensitive to that. And so you're basically taking a jaw that's dealing with tension, that's resting in a side bent or side shifted position, and then asking it to chew up and down and find the same spot for the teeth to match up every time you bite or chew. And so that sort of stress over time also leads to the level of tension that someone might have. And then that tension can display itself at night as like clenching, grinding, like the level of tension you carry through your muscles can lead to sort of an unrestful, like your inability to rest at night. Like your muscles don't know how to calm down because they're just always on, like they forgot how to shut off. Think of it that way. So we got two things. We've got airway and then we've got the neck. So when it comes to the jaw, I would look at those two things. I would try to understand like what is a potential airway issue? What is the neck doing? And how do those things match up to allow this person to get out of their jaw pain? Now, we do want to work on the jaw itself. Like I said, there is a place for retainers, for night guards, for things like that, for appliances that help with the jaw. But by and large, we want to make sure that we don't miss those two things. And I do find that oftentimes in our healthcare system, those two things may be missed. And so things you can do about it, like I said, I want you to wear a breathe right strip. I'm not like getting paid by them. My wife and I use them and we find them very helpful to get better sleep. I want you to breathe through your nose. So if you are a mouth breather, try mouth taping or just train yourself to stop doing that. And especially at night, if you can't figure out how to not breathe through your mouth, like mouth taping has worked wonders for several of our patients. And then consider your neck. So consider the postures you're in throughout the day. The next posture is the best posture. So keep moving and make sure that you are dynamic, that you're standing and sitting in a symmetrical, like neutral position rather than shifted onto one side or the other. Sometimes that means more of an active stance, like your knees are bent a little bit. Not that anyone's looking at you funny, but just like a little bend in the knee will engage your core, which will help the spine out, which will help your neck. These are little things, but they do add up and they do help over time. So there you have it. If you are looking for relief from your jaw pain, jaw tension, if you have clicking, popping in your jaw, if you've worn a retainer forever and you're like, man, I would really like to stop wearing this, or a night guard, I should say. If you have headaches or migraines associated with jaw pain, we want to help evaluate this in you and point you in the right direction and help you solve the underlying problem so that you understand your situation better and know how to find true relief. If that sounds like you, I want you to book our free first visit. It's totally free. It's called a discovery visit. You can book it right on our website. You can do a virtual if you're like out of state or maybe just like not finding the time to come in, but you live local, or ideally we do an in-person visit if you're in Colorado, and then we can hear more of your story and help you navigate this through our, what we call our 3-spoke framework, which involves thinking through things just like we did here on this podcast, but in your specific situation. We would love to help. Thank you all so much for being a part of our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.